All right, good morning, my friends. Thank you for joining us for this 1 hour webinar hosted by Prevention Plus Wellness LLC, located here, beautiful St. Augustine, Florida. My name is Dr. Chudley Wirch. I'm the founder and president at Prevention Plus Wellness. So really excited about this webinar. It's a brand new webinar. Worked hard on it. There's just a ton of information on this topic of integrating wellness with substance use prevention and the positive outcomes that has not just in physical health, but mental health. So the focus on mental health, that's what today's topic is. And of course, as you can see by the title, addressing wellness in substance use prevention promotes youth mental health. So that's what we'll be talking about for the whole hour. Everyone will get a certificate for 1 hour CEU for listening in. You'll also get a PDF of the slides I'll be showing you, and you'll get a link to the recorded session. So this is being recorded, and please do share the link to the recorded session and the slides widely in your region, in your state, in your nation, with your colleagues and your friends. I would really appreciate that. This is very, very, very important information. It's fascinating information. It's eye-opening for me. I think it will be for some of you as well. There's just a ton of research. I was unaware of the quantity and the quality of the research that's available, particularly looking at wellness behaviors and mental health promotion. Very exciting stuff. So let's go ahead and jump in. I'm going to be moving fast. There's a lot to cover here. I'm hoping to have some time at the end for Q&A, but I may not. I'm happy to stay longer if you want, but I want to get through the content with you. So buckle your seatbelts because we're going to be moving through a lot of content very quickly today. Lots and lots of good information. All right, I see that sunlight is on my face. That's distorting and making it a little bit difficult. So I'm just going to shift myself over a little bit. All right, so here we go. 4 session objectives. So you'll be able to, with me today, explore associations between youth substance use and mental health problems. Of course, we all think we know what those relationships are, but let me just clarify those for you by looking at some of the more recent research, just to reinforce what you do already know about those associations between youth substance use and mental health. Secondly, we're going to assess the evidence of the role of physical activity as well as nutrition, sleep, and stress reduction on mental health, as well as two specific types of mental health issues, depression and anxiety, and all of that will be, or at least the majority of that research on youth and young adults. Thirdly, examine the association between the United States adolescents' healthy behaviors and mental health indicators. These are actual data from CDC, and I ran some analyses and we'll be sharing that with you. And lastly, we're going to review research examining the role of multiple healthy lifestyle behaviors on mental health of youth. So let's start, first of all, by looking at youth substance use and mental health. So this first study, 2018, was published in the Canadian Journal of Psychiatry. The title, Early Adolescent Substance Use and Mental Health Problems. This was a rather large study, over 1,300 7th and 8th graders in Ontario. And those first couple of points are about the quality and the methodology of the study. Internalizing, externalizing mental health problems was assessed. I don't know if some of you are familiar with the Global Assessment for Individual Needs, a short screener. Distress was defined as fair or poor, and that was a self-rated mental health. And starting with number 4, some of the results, substance use was associated with increased odds of internalizing and externalizing problems as well as distress. Youth using cannabis had 10 times the odds for internalizing or externalizing problems. And number 6, the use of substances other than alcohol and cannabis were also associated with increased odds of fair or poor self-rated mental health among 8th grade students. So you can see this relationship between substance use, and different indicators of mental illness or mental problems among young people. Continuing on with more of the results from that particular study, even low levels of substance use and substance use problems were substantially associated with increased risk for screening positive for internalizing and externalizing difficulties, youth with co-occurring substance use or substance use problems and mental health problems reported even greater severity of mental health problems than youth without concurrent substance use. Results underscore the need for implementation of effective school-based prevention models that integrate substance use and mental health. So this is a very important study, I think, indicating the role of substance use in terms of onset of mental health problems for young people, how substance use can make mental health problems even more severe, and the authors, the researchers, highlight the importance for integrating substance use and mental health. The connection between substance use disorders and mental health, this is NIDA, National Institute on Drug Abuse. By the way, did you notice that what I'm doing here is I'm identifying the source of these studies, and also I'm showing you and providing you with a link at the end of the last slide so that you can actually go read more from that story. Some of these research studies are full publications, full article publications. Others are abstracts, or others like this is an actual NIDA research report on their website. So let's take a look at connections between substance use disorders and mental health. There's three main pathways for contributing and to thinking about how this comorbidity works between substance use disorders and mental health. Three connections or three pathways. Number one, common risk factors can contribute to both mental illness and substance use and addiction. In other words, we do know, and these are just some of them, we do know that there are genetic vulnerabilities, there are differences in brain function among youth, stress levels, childhood trauma. All of these things could be factors that connect mental health as well as substance use. Secondly, we do know that mental illnesses can contribute to substance use and addictions. And then thirdly, substance use and addictions can contribute to the development of mental illness. So those are the three pathways for these connections. Let's look at this a little bit more closely. So number one, research suggests that adolescents with substance use disorders also have high rates of co-occurring mental illness. For example, 60% of adolescents in community-based substance use disorder treatment programs also meet the diagnostic criteria for another mental illness. Data show that high rates of comorbid substance use disorders and anxiety disorders exist. Substance use disorders also co-occur in high prevalence with mental disorders such as depression, bipolar disorder, ADHD, and others. So there's that connection, that overlap, that interrelationship between substance use and substance use disorders, as well as mental health issues or concerns or a problem. Continuing on, again, this NIDA report, early drug use is a strong risk factor for later development of substance use disorders. It may also be a risk factor for later occurrence of other mental illnesses. So that's why prevention specialists, you and I, very, very much focused on delaying the experimentation and use, and certainly addiction to substances among young people. Lastly, an example number 6, we do know that frequent as well as heavy use of marijuana during adolescence can increase the risk of psychosis in adulthood, specifically in individuals who carry a particular gene variation. So we can see that substance use can precede mental health problems. And we can see in this particular case how certain gene differences from one youth to another can play a role. And there's the link to that online NIDA document. So that's a little bit about, showing this association between substance use and other mental health illnesses and disorders and problems. And those things seem to be bidirectionally related. Substance use increases the risk of other mental health problems and vice versa. Now let's take a look at these wellness behaviors, these individual wellness behaviors, and let's look at the role that they may play in mental health: physical activity, nutrition, sleep, and stress relaxation. Starting with physical activity, here's a great study. It's a review of reviews, physical activity and mental health in children and adolescents, published just last year. A review of reviews means that it's a review of other reviews of research. So it's really capturing a huge amount of data. It's not a review of individual studies, it's a review of other reviews of studies. So I like these studies in terms of the breadth and what they could tell us as researchers and practitioners, particularly as practitioners. So the number of articles of reviews that were included in this study were of physical activity, were 4 dealing with depression, as you can see there, 4 dealing with anxiety, 3 with self-esteem, and the most 7 were with cognitive functioning. There was an association between physical activity and mental health in young people that was evident in these studies. And the evidence showed that small but consistent associations between sedentary screen time and poor mental health. So this review of reviews actually showed 2 things: that there was an association between physical activity and mental health, more physical activity, less mental health, etc., and vice versa. Meaning less physical, more physical activity, less mental health, more physical activity, less mental health. And also the flip side of that, which is this measure of a sedentary screen time, sort of the opposite or related issue to physical activity, which also showed more screen time, poor mental health. Then this study was published, let me just see here, this is a little physical activity, mental health in children, adolescents. This was an updated review of systematic reviews and meta-analyses. This is again a review of reviews. Physical activity interventions were found to have effects on depression, and those effects were moderate in strength. That moderate is a significant strength. There's small, there's moderate, there's large. So this is like a middle size. And so physical activity interventions had a moderate strength effects on depression and reducing depression. Variable effect sizes were also evident from interventions for the reduction of anxiety and improvement of self-esteem. Higher or improved fitness and physical activity were associated with better cognitive health and performance. Excuse me. And lastly, number 5, the strongest evidence for causal association appears to be for cognitive functioning, and there is partial evidence as well for depression. So a highlight on physical activity and different indices of mental health for children and for adolescents. This was a review of reviews. Then there's a study just done earlier this year on depressive symptoms. So we're looking now at specific mental health issues. This one, depressive symptoms and physical activity and sedentary behaviors. This was a prospective cohort of over 4,200 adolescents. A total follow-up time of 6 years. This is a very good study because it's prospective. That means you start with a group, a sample, a population, and you track them, you follow them. And of course, this was following these youth for 6 years. It included participants with at least 1 accelerometer recording. In other words, they're using, I don't know if you're familiar with accelerometer. It's a tool to measure physical activity. It's actually a device that's put on the body of youth, and now also clinical interview schedule revised version, and this was for adolescents. So total physical activity decreased between ages 12 and 16 years. Those very important middle school, high school years, driven by a decrease in duration of light activity and by an increase in sedentary behavior. Keep that in mind. Physical activity decreases between ages 12 and 16, and that seems to be driven by reductions in light physical activity and increases in sedentary behavior, screen time, etc. Here are the key results. Number 7, higher depression scores at 18 years of age were associated with 60 minutes a day increasing in sedentary behavior at ages 12, 14, and 16. In other words, increases in screen time and less physical activity at ages 12, 14, and 16 increase the depression scores at age 18 down the road. Depression scores at 18 were also lower for every additional 60 minutes a day of light activity. So there you see the relationship between decreasing light physical activity and increasing depression later on in life. So these very important developmental years, 12 and 14 and 16, those years of physical activity, sedentary life had an impact on depression at age 18. Moderate to vigorous physical activity also was associated with less depression symptoms. Sedentary behavior displaces light physical activity throughout adolescence and is associated with greater risk for depressive symptoms at age 18. Very, very important study there about physical activity. Here's another physical activity: depression, anxiety, and self-esteem among children and young and youth, I should say. This is a systematic review of reviews. Again, review of reviews, not just review of studies. 14 looked at depression, 2 anxiety, 14 on self-esteem. This was published just last year. Physical activity had a positive mental health outcome for children and youth, specifically for reduction in depression and depression symptoms. Little research examined physical activity and anxiety. So there's more research that examines physical activity among children, youth, young adults, and its impact on mental health generally, as well as on reducing depression and depression symptoms. A little bit less research looking at the role of physical activity on reducing anxiety. Physical activity and anxiety. Here we go. We're taking a look at one study. This was done just last year. This is a systematic review and meta-analysis of prospective cohort studies. Remember what I said before? Prospective, that goes over, it's longitudinal across time. Cohort meaning they're following the same individuals over time. Now, the problem with this study is it's of adults. There's more research on adults and youth in this area of anxiety and physical activity. But the studies of adults involve 3 outcomes: self-reported anxiety symptoms, diagnosis of any anxiety disorder, and diagnosis of generalized anxiety disorder. There were 24 studies, 13 meta-analyses, and the available evidence suggests that engaging in physical activity protects against anxiety symptoms and anxiety-related disorders. All right, the only problem, this study was of adults, but there's a good indicator that the possibility for youth. So those are the physical activities, strong physical activity studies, reviews, many of them reviews of reviews. And now let's take a look at the role of nutrition and mental health, including depression and anxiety. This was a study of the relationship between diet and mental health in children and adolescents, published 2014. Systematic review of 12 epidemiologic studies. There's a consistent trend for the relationship between good quality diet and better mental health, and some evidence for the reverse. In other words, some evidence for good mental health and better nutrition. The findings highlight the potential importance of the relationship between dietary patterns and quality of diet and mental health early in the lifespan. And these were studies of children and adolescents. Another study published just last year on nutritional aspects of depression in adolescents. This was a systematic review, about 1,000 articles, in other words, 1,000 different research studies. And the findings highlight the potential importance of the relationship between healthy diet patterns and quality diet and positive mental health throughout the lifespan. Various nutritional and dietary compounds have been suggested to be particularly involved in the onset, maintenance, and severity of depressive symptoms and disorders. Healthy foods. I like this item number 4 right here. Healthy foods. Here's some indicators. Here's some really practical information for you as a prevention specialists and wellness providers and health providers. Healthy foods such as olive oil, fish, legumes, dairy products, fruits and vegetables have been inversely associated with the risk of depression and might also improve depressive symptoms. So those are very healthy foods. Let me just go ahead and continue on with more results of this review. Western dietary patterns, which include more consumption of sweetened beverages, fried foods, processed meats, baked products, have shown to be associated with an increased risk of depression in longitudinal studies. Diet and nutrition offer key modifiable targets for the prevention of mental disorders. We advocate, these researchers do, advocate for the recognition of diet and nutrition as crucial factors in preventing and management of mental disorders. So we saw strong evidence showing physical activity having a role in mental wellness and preventing mental problems, perhaps like depression, anxiety. Now the same thing with nutrition and quality of diet. Let's take a look at the evidence supporting sleep and mental health. Here's links between adolescent sleep deprivation and the onset of mental disorders. This was a review of research. Sleep deprivation is associated with many mental disorders. Adolescents are at increased risk for chronic sleep deprivation at that time of development. Adolescence is a period when the majority of mental disorders first emerge as well. So here you got this perfect storm. Young people are at an age of development where chronic sleep deprivation is common. That's also when mental health disorders first emerge. Number 5, sleep deprivation is also associated with reduced frontal limbic conductivity. So we're seeing these neurological brain changes associated with sleep and sleep deprivation. So we're seeing that may be one factor that links sleep with mental health, the brain formation, brain development. Sleep in adolescence, physiology, cognition, and mental health. This is a review of research. Recent and emerging data indicate a key role for sleep in supporting cognitive function and mental well-being in adolescence. So a good review of research highlighting that. Sleep, brain development are bidirectionally related. Sleep improves brain development improves sleep, and the opposite is true. The chronic insufficient and poorly timed sleep that's endemic amongst young adolescents is a concern. I mentioned that already from the previous review that we looked at. Public health interventions targeting sleep can promote sleep during this important developmental period. So there's a call by some researchers to target sleep. You might also say physical activity and nutrition among youth, among adolescents, among this developmental period of time because of the potential role it has in protecting and improving and preventing mental health and preventing mental disorders and problems. Relationship between sleep and depression in adolescence. This was a meta-analysis of 23 studies. The overall effect sizes from longitudinal and treatment studies, those are the stronger studies, suggest that sleep disturbance acts as a precursor to these development of depression. So again, you got treatment studies, you've got longitudinal studies. Some of the best studies that we can conduct in terms of research design show that sleep problems with sleep, lack of sleep, sleep deprivation leads to later on development of mental problems like depression. At follow-up, depressed adolescents had significantly longer sleep onset. In other words, it took them longer to get to sleep, more wake after sleep onset, and lower sleep efficiency compared to adolescents who were non-clinical or had undergone remission. Little support was found for a predictive role of depressive symptoms in the development of sleep disturbances. In other words, this meta-analysis found that it's really the sleep issues that initiate and may even be causal factors of depression, not the other way around. Sleep and anxiety in late childhood and early adolescence. This was a review of research. Prospective studies, longitudinal studies, supported that sleep predicts anxiety symptoms in early adolescence. And preliminary evidence suggests that late childhood to early adolescence may be a sensitive period for escalating problems with sleep as well as anxiety. So this is, we've restated this, highlighting this association, this very important developmental period for youth with regard to sleep and with regard to mental health issues like anxiety, depression, and others. Here's a study of adolescent sleep problems, emotional regulation, affective disorders. This was conducted a couple years ago. This is a national comorbidity survey, adolescent supplement. This is a national representative sample in the US, over 10,000 youth, very, very large study. A diagnostic interview was determined if adolescents qualified for mood or anxiety disorder in the past year. Number 3, adolescents who reported greater sleep problems were more likely to qualify for a mood or anxiety disorder and generally reported poor emotional regulation. Adolescents with greater sleep problems reported less problem solving, greater avoidance, suppression, rumination, and acceptance. Continuing on with the results of this national study, sleep problems were indirectly associated with anxiety disorders through greater suppression and rumination. In other words, these are the drivers or the factors through which sleep and mental health problems may be occurring. We're talking about suppression and rumination. And indirectly, sleep problems indirectly associated with mood disorders. How? Through, again, greater rumination and lower problem solving. So those are the moderating factors, rumination and lower problem solving. Certain emotional regulation strategies may be more difficult for youth struggling with sleep. So this is the mechanism that this study is highlighting, that it may be emotional regulation. That's the moderator between a lack of sleep and mental health problems. So poor emotional regulation may be one factor that contributes to sleep-based psychiatric risk. So when you have, social emotional learning, education, training, where you focus on emotional regulation, very important to prevention of psychiatric risk, likely, but the precursor to that could be the lack of sleep. So these things are associated, sleep and emotional regulation and affective disorders. Let's take a look at, lastly, stress reduction. And this study looked at the effects of mindfulness-based stress reduction on depression of adolescents and young adults. So mindfulness is a form of meditation. This was a systematic review and meta-analysis, included 18 RCTs as randomized controlled trials. That's the best design for research that we know of. The best quality research is a randomized controlled trial. You've got an intervention group, you've got a control group, you have data before and after, and sometimes follow-up, with over 2,000 youth in these studies. And so mindfulness-based stress reduction, or MBSR, had moderate effects, not small, not large, but moderate effects. Those are medium-sized effects in reducing depression symptoms at the end of the intervention for adolescents and young adults. No statistical significant effects were found at follow-up because there was just a lack of power. There's a lack of a sample size. They didn't have the numbers to find the power that may or may not have been there at follow-up. So mindfulness-based stress reduction was efficacious for both clinical and non-clinical groups. In other words, for youth, that general populations of youth and young adults. And it's applicable to generally healthy individuals to reduce depressive symptoms and to promote emotional well-being. So these authors are highlighting the potential for mindfulness-based stress reduction, a type of meditation, a very popular type for improving emotional well-being and reducing depressive symptoms of youth and young adults, at least at post-program. We also looked at this yoga interventions for anxiety reduction among children and adolescents. This was a systematic review of interventions of youth ages 3 to 18. There were 16 articles and 6 randomized controlled trials. Those are the good studies, best designs available. Nearly all students indicated reduced anxiety after a yoga intervention. Yoga, and this is important here under number 4, yoga defined as postures, but also controlled breathing and meditation may be effective in reducing anxiety and anxiety-related symptoms or behaviors in children and adolescents. Significant decreases in anxiety may be observed only in yoga programs that are provided at higher frequency levels. In other words, 3 or more times, 2 to 3 times a week. So again, like anything, if you were taking a medication to reduce anxiety, you might regularly take that every day of the week. This is not surprising to me. This research showing that yoga interventions may be effective in reducing anxiety among young people, but it has to be a regular practice. It has to be built into your routine. All right, now let's take a look at some actual data. These are actual data looking at, as a title here, adolescent wellness behaviors and mental health indicator. The indicator is feeling sad or hopeless. Where did this data come from? CDC, Centers for Disease Control Prevention. It's the Youth Risk Behavior Survey data, their analysis tool. You could locate it online and you could run your own analyses. This is the most recent data, just updated recently, 2019 data. And the data we're looking at is data for the whole United States and high school adolescents. Okay, so let's take a look at the relationship between healthy behaviors and this indicator of mental problems, which is feeling sad or hopeless. What's the association between getting 60 minutes of physical activity 5 days a week and feeling sad or hopeless? Well, this is a significant association. We see those that get physical activity, 30% had reported feeling sad or hopeless, whereas those who didn't get that amount of physical activity, 42% reported quite a bit more, another 12% reported additionally feeling sad or hopeless. And that was a very relatively, I would say, very strong association, P level 0.0000. So good association, strong association, more physical activity, less feeling sad or hopeless, less physical activity, the opposite. Now let's take a look at the opposite of that, or a related measure, if you will, not exactly the opposite, but not watching 3 or more hours of sleep. So 3 or more hours of sleep is an indicator of sedentary, screen time and sedentary behavior. We're looking at this from the flip side, did not watch 3 or more. And you can see, again, this is significant association. For those that didn't watch TV, didn't watch as much TV, 36% reported feeling sad or hopeless, versus 40.5% of those who were watching more TV feeling sad or hopeless. Again, less TV, less indicator of sad or hopelessness and mental health issues, more TV or more sedentary life, more reports of sadness and hopelessness. Now let's take a look at some nutrition measures. Eating breakfast last 7 days by feeling sad or hopeless, very significant association. Those who ate a regular breakfast, 25% reported feeling sad. Quite a bit more, 42, almost 43%, who didn't eat a breakfast every day of the week reported sadness and depression. Let's take a look at the drinking milk, because there's a significant association between those who drank milk and those who didn't. Those who drank milk, 35% reported sadness and sadness and hopelessness. Those who didn't drink milk, almost 42%, quite a bit more reporting sadness and hopelessness. Let's take a look at one more nutritional measure. Did not drink soda. That also correlated, or I should say associated, with those not drinking soda. 33% reported sad and hopeless, versus those who did drink soda, 39%. More soda, more sadness and hopelessness. Now let's take a look lastly at sleep. Very strong association here. Those who get 8 or more hours of sleep, 24% reported being sad or hopeless, versus almost 41% who do not get 8 or more hours of sleep, saying that they're sad or hopeless. So very interesting relationships, associations between these healthy behaviors. But it's not just with that measure alone, because there is another measure on the YRBS data collection, which is seriously considering suicide. Also, I think a very good indicator of mental health. And we found these same 6 behaviors to be significantly associated with less serious consideration of suicide. All 6 of these behaviors that were associated with feeling sad and hopeless, also associated with seriously considering suicide. In other words, 60 minutes of physical activity, not watching a bunch of TV, eating breakfast, drinking milk, avoiding soda, and getting 8 or more hours of sleep. All of those were significantly associated with less serious consideration of suicide. Another very good indicator of mental health or mental problem. Now, let's take a look at sort of a broader picture, multiple health behaviors. Let's take a look at the research that actually didn't look at a single behavior like physical activity or nutrition or sleep or stress relaxation, but actually looked at a combination of multiple health behaviors and the role of them on mental health. Lifestyle behaviors and mental health in early adolescence. This was a population-based prospective study over time, 3,400 youth, 2011 was the health behavior survey data. 10 to 11-year-olds was administered, and then it was re-administered anywhere between 2011 to 2014. The Harvard Food Frequency Questionnaire, self and parent proxy reports were included. Meeting recommendations for, here under number 4, this is very important. Meeting recommendations for vegetables and fruit, grain product consumption, milk and milk alternatives, meat alternatives, added sugar, saturated fat, screen time, and physical activity. Those were the recommendations. Did these youth meet these recommendations, and if they did, what was the effect on mental health? Mental illness was defined as physician diagnosed, internalizing, externalizing, or other psychiatric conditions, and the analysis used, for those of you that are statisticians out there, negative binomial regression analysis. So that's the study design. Let's take a look at the results of this prospective study. The results are very interesting. Meeting 7 to 9 recommendations, there was a total of 9 healthy behavior recommendations. Remember what they were? They included different types of nutrition, sleep, screen time, physical activity. So for youth that met 7 to 9 recommendations of those healthy behaviors, was associated with 56% fewer physician visits for mental illness at follow-up. So these healthy habit recommendations being met, less problems later on in life with regard to mental health visits to the doctor. Every additional recommendation that was met was associated with 15% fewer physician visits for mental illness. So More health behaviors, less mental illness. Mental illness in adolescence is associated with compliance to lifestyle recommendations in childhood. Stronger associations are seen when more recommendations are met. Emphasizing multiple health behavior lifestyle recommendations may reduce future burden of mental illness. Promotion of multiple health behaviors may have more pronounced effect on reducing mental illness than targeting single behaviors. So this research indicates that important to address more than one health promoting and mental health promoting behavior. Not just physical activity, sleep, nutrition, all these things together, very important to promoting mental health. Here's another study, health promotion behaviors in adolescents. This study was designed to determine the association between mental health status, depression and/or conduct problems, and health promotion behaviors. It was a study done using 2010 data in Washington State Healthy Youth Survey. Descriptive statistics, linear regression were performed. A small minority of youth met all 6 recommendations. And here are the domains, the health behavior recommendations: tobacco abstinence, substance use abstinence, daily physical activity, breakfast consumption, weight below obesity levels, and adequate sleep. Mental health status was strongly associated with a number of health promoting behaviors, much like the previous study. Interventions to increase sleep and exercise should be added to school and community and primary care-based adolescent health initiatives, and I say also to prevention, substance use prevention initiatives, because of the role on mental health. Now, here's another study, multiple health risk behavior and psychological distress in adolescents. This was a representative sample of over 2,900 students, ages 9 to 12, so about middle school and going on to high school. 2009 Ontario Student Drug Use and Health Survey. Significant associations were shown between psychological distress and the following: being female, tobacco use, not meeting physical activity and screen time recommendations, and inadequate consumption of breakfast and vegetables. These findings highlight the need for targeting greater physical health promotion for adolescents at risk for mental health problems. And I would say the majority of adolescents are at risk for mental health problems. So what can we conclude? How can we piece all this together? I put this together for you. One way to look at this is in this particular model. I call this an integrative and interconnected model for promoting youth wellness. So take a look at this model and see if this makes sense to you. So if you start on the left-hand side, SUP refers to substance use prevention. Below that is HPPV, that's healthy behavior promotion. And to the right is mental and physical health. So here's the model. Starting at the left, substance use prevention plus health behavior promotion, and you can see the arrow to the right, can improve, and we expect it to improve both mental and physical health. So substance use prevention integrated with health behavior promotion can particularly increase both mental and physical health. And improvements in mental and physical health then go back in the other direction with those other arrows. Mental and physical health promotion can support and improve the avoidance and the prevention of substance use, and improved mental and physical health promotion can also help support and improve individual healthy behaviors. So that's the model. It's integrative because we're integrating substance use prevention with healthy behavior promotion. And you can see the interconnection between those practices, substance use prevention, healthy behavior promotion, how they can increase mental and physical health, and how increased mental and physical health can then support substance use prevention and health promotion. And this is a wellness model. This is not just looking at physical health, not just looking at mental health, not just looking at a sub component of mental health, substance use, but all of these things together are integrated in this very model, which is, I think, is a relatively simple model. So let's take a look at the conclusions. We have a lot of time. I ripped through this so quickly, I didn't know if I had enough time. So I can go back to some of this research if you'd like. But let's take a look at the conclusions, which I think are very, very important and help summarize everything for you because we covered so much today. Number one, substance use and mental health problems are bidirectionally associated. That means substance use does appear, at least in some cases, to increase the risk for mental health. Mental health problems increase the risk for substance use problems and addictions. So that's bidirectionally associated. I think those of you in the mental health and substance use arena already know this, but I wanted to just touch base on that very briefly and talk about a couple of broad studies and that large report from NIDA on our latest thinking about how this occurs, how do these behaviors occur, and what the relationship is between substance use and mental health in young people. Secondly, significant evidence indicates the relationship between physical activity, nutritional patterns and quality of nutrition, quantity and quality of sleep and stress reduction, and mental health outcomes, including depression and anxiety within youth. So these behaviors, these healthy behaviors, are very much important to the mental well-being of youth, and perhaps even to preventing and reducing symptoms of depression and anxiety, as well as some other benefits, cognitive development, etc. Thirdly, healthy behaviors among U.S. adolescents. We did that analysis, those associations with the YRBS data, and what we found there among United States adolescents, that there was this association between mental health indicators, particularly feeling sad and hopeless, as well as seriously considering suicide, and a number of healthy behaviors, physical activity, sedentary behavior, screen time, different eating breakfast and different types of nutritional behaviors, getting sleep, all of those very, very much associated with these mental health indicators, feeling sad and hopeless, and even seriously considering suicide. Number four, multiple healthy lifestyle behaviors are linked to mental health among youth. And the recommendation from those large studies and prospective studies is that multiple health habits should be addressed to promote a mental health of youth, not just single behaviors, not just physical activity, not just nutrition, all of these things. Lastly, adopting a model that integrates substance use prevention with multiple health behavior promotion can improve mental and physical health of youth. There it is right there one more time. Substance use prevention plus, I would really say, multiple health behavior promotion can improve both mental and physical health, and that can turn around and influence these other things as well. Substance improvement and support of avoiding substance use and promoting those protective wellness behaviors. Here's just three, youth substance use and wellness resources I came across that you might find interesting to explore. I wanted to give you a little bit more to think about. Once again, all this comes from preventionpluswellness.com. There's our website, preventionpluswellness.com, and you can learn more about what we do and how we integrate substance use prevention with the promotion of protective wellness behaviors. Those kinds of interventions, those integrative whole health interventions, have real potential for improving both mental and physical health of youth. You can learn more about our programs and training under this link. We have a online catalog of our more popular items. You could request a sample of any of our programs by clicking on that link and just letting us know. We could send you an electronic sample of any of our programs. That's preventionpluswellness.com. Our phone number here in Jacksonville, Florida, 904-472-5022. And info@preventionpluswellness.com is our email. So let me stop at this point and see if anybody has any questions. I went through a lot of content very quickly, a lot of good content, a lot of good research. I was actually surprised at the level and the quality of research associating, of course, we know associations between substance use and other mental health issues, but the association between these various healthy behaviors and healthy behaviors overall, lifestyle behaviors, and the impact that that has on mental health generally, the promotion of mental health, the prevention of depression and anxiety, a tremendous amount of evidence there supporting that. And that certainly supports and raises the bar for all of us as prevention specialists to address these healthy behaviors in our prevention programs, and vice versa, I would say, and vice versa. When you address healthy habits, whether that's physical activity, nutrition, sleep, stress reduction, or whole health programs, all of those behaviors and substance use always should address substance use with those and vice versa. And that can really have a significant impact on the mental health. And mental health is such an issue, such a developing, increasing issue, considering suicide, indicators, a frequency of feeling sad and hopeless and depressed, really, not to mention depression symptoms, anxiety, on and on. These things are occurring at alarming rates among young people. And the pandemic certainly isn't helping any. Really important for all of us as prevention and health specialists, therefore, to really consider integrating our substance use prevention with our healthy lifestyle behavior promotion. All right, let's take a look at if you've got any questions. Here's one Q&A from Reverend. What role does spirituality play? Spirituality plays a tremendous role. I started reviewing that because we have, of course, we have one spiritual program, the In God's Image program. That program is a little bit different than our other programs in that we integrate the promotion of spiritual practices and attitudes. So it's very good. It's I would say it's even our more holistic, our more whole program, because we're bringing that in. So just to answer your question, Reverend, there's a lot of literature and a lot of reviews of research showing that spirituality and religiosity can improve both healthy behaviors, physical activity, nutrition, sleep, stress control, and it can reduce substance use, and it can reduce other mental health issues. Now, there's some research that also shows certain kinds of religious beliefs and practices can also have a negative impact. In other words, can actually increase mental health problems. But the majority shows quite the opposite. The majority shows spirituality, these attitudes, these beliefs, and these practices are very much positively associated with healthy behaviors, the avoidance of substance use, and the reduction of mental health. The problem with it, as I see it, I'd love your point of view of it, is that at least in our society, at least in the United States, we cannot generally address spirituality in public schools. No, that's just the problem. We cannot address it. So we're limited to addressing it then only in faith-based settings, faith-based schools, those faith-based organizations, etc. That doesn't mean that that's a problem, except for the fact that you cannot have it more widely used where youth are, and that is we can't get, unfortunately, that spirituality and religiosity positive messages out to youth at least in the United States, because of the church-state separation. Now, there's quite a bit of advocacy going on, both from researchers and from faith-based settings to change that, to get more of this, because this is science-based. This is science-based knowledge about how certain spiritual beliefs, attitudes, and practices can actually improve significantly the health, including reducing mental illness among young people. Very, very important. But because of that, because it is spirituality, it's something that is not something that you can readily teach. So the issue is, how do we get that to youth more generally? So that's a very good question, and something I'm very much interested in. So thank you for raising that. Let me know what else you think about that. Let's see if there's any questions or comments. This was terrific. Thank you, Chudley, for all you do. Also for being a stable breath of being a stable breath of air about that during this pandemic, and for your constant smile and humor. But thank you very much for that. I don't know if that's stable breath or stale breath, but nonetheless, I appreciate it very much. Thank you for all of your kind comments, all of you. That's wonderful. You will get, all of you, you will all get a PDF of the slides. You'll all get a link to this recorded session. You'll get a certificate for 1 hour CEU. Okay, so no need to ask that. I'm going to send it out for all of you. Okay, I'm going to send it out for all of you. So, and then you'll be able to just click on those links. You'll be able to explore this. You'll be able to share this with your colleagues, with your students. If you have questions, if you have problems, if you don't understand things, if you want something else, if you need some other content, like was just brought up, spirituality, etc. If you have some other ideas for future reviews of research by us, remember, we're really tied to this integrative model. We really believe that that's really essential to youth overall health. We really believe, and the research I think highlighted today, that integrating substance use prevention with healthy behavior promotion, really, really important to driving and improving and increasing mental and physical health of youth, and that can improve avoidance of substance use and healthy behavior development. So these things are related. They're circular. Another way to look at it is a circular model. They're very much associated with each other. And to focus more narrowly on specific healthy behavior problems, or like physical activity or vaping or something like that, that's fine. All of that is important. But what's also important to address overall health and maybe even have broader effects and be more cost effective, we really believe, and I think the research highlights the importance of this integrative kind of a strategy, integrative model that we propose at Prevention Plus Wellness, and we support that. So these are slides. I mean, that's it. I'm done. I don't have any other comments to make. I'm going to double check one more time, make sure there isn't any other question or comment from anyone. That's it. You've got a lot to think of, a lot to look at when I send this out to you. So do remember that I'm laughing at some of the comments here. I like them. So for convenience, I wore light clothes and performing push-ups and a basic plank. That's, you can't beat that. You're listening to a webinar and you're doing physical activity. Who is that? That is a tremendous role model for all of us to practice. Thank you very much for that. That's tremendous. So I'm just going to end at this point, and thank you all for what you do. And again, God bless you. Keep up the good work with your youth, with your families, in your communities, in your areas. And if there's anything we can do to support you, let me know. Stay safe, be healthy, everyone, and have a great afternoon. Bye-bye.